Hi, this is Prince Kannankeril. I'm a heart rhythm specialist at Vanderbilt University in Nashville, Tennessee, and I'm responding to a question posed to the SADS Foundation Ask the Experts program. The question is, my 3-year-old daughter and husband have CPVT. How effective are the beta blockers they are taking? Well, CPVT stands for Catecholaminergic Polymorphic Ventricular Tachycardia. This is a genetic heart rhythm disease that can cause a potentially life-threatening arrhythmia, typically during exercise, stress, or anxiety. These are all situations in which the body produces catecholamines, or adrenaline. And in CPVT, there is a molecular defect that makes the heart muscle cells more prone to arrhythmias in response to catecholamines. Now, beta blockers blunt the body's response to catecholamines, so it makes sense that they would be effective in CPVT. And beta blockers are, in fact, universally recommended for all CPVT patients. As for how effective are they, well, we do know that the majority of CPVT patients are protected by beta blockers. However, up to 30% of them will continue to have serious clinical events, and by clinical events I mean syncope or passing out, cardiac arrest, or sudden death. Now again, that means that the majority, or 70% of patients, will do just fine with beta blockers as their only medication. As for specific beta blockers, there is some evidence to suggest that nadolol is superior to other beta blockers in treating CPVT. Again, this isn't definitively proven, simply suggested by data, but most of us that treat CPVT patients use nadolol as our first choice. Nadolol is a good beta blocker to take in general because it has a low side effect profile and can be taken once a day. Now, what about those 30% of patients who are not completely protected by beta blockers? Well, there are several potential options. These include surgical procedures like left cardiac sympathetic denervation, as well as implantation of an ICD or defibrillator. Both of these have specific advantages and disadvantages in CPVT. One of the more exciting developments in the field is the discovery that a medication called Flecainide directly targets the underlying molecular defect in CPVT. Flecainide is an antiarrhythmic drug that's been around for a long time, but this specific action was completely unknown until recently discovered. Flecainide is very effective in animal and cellular models of CPVT, and initial studies in human patients are also very promising. Right now we're enrolling patients with CPVT and an ICD into a multi-center prospective trial looking at the efficacy of Flecainide in CPVT. If you're interested in learning more about this trial, you can find information about it on the SADS website.